I'm a founding member of the International Medical Spa Association, and whenever that happened, I really didn't think that the business was going to take off like it did. I really do guesstimate, project, theorize that at least 50% of all estheticians coming out of school will work for a physician at some point in time. There's laws and legislation being passed right now to protect the physician, and so be aware that that might change some of your scope of practice, but in reality it's actually elevated our profession, and I'll talk about that a little bit later. But welcome to this profession. We're going to teach you to be a medical esthetician, and we're going to teach you to do things with a scientific and clinical background, but it does not mean that you have to go work for a physician when you're done. You can always work for yourself and still do most of the techniques, except for some of the pHs and percentages of the acids. All right, that's the only thing that will really change. But again, you can do this with or without a doctor. All right? I'll give you a little bio about myself so that you know that I'm capable of teaching this class, and then we'll talk a little bit about you as well, and then we'll go from there. I am an esthetician. I've been an esthetician since 1995. I've also hold the first full curriculum specialty aesthetic instructor license in the first one. I'm also a registered, now called licensed massage therapist, because we changed departments, and I've been that for 10 years as well. I'm a massage therapy instructor. For about 3 to 4 years of my life, I taught morning massage school, advanced aesthetics in the afternoon, and night school in massage therapy while I maintained a private practice and consulted on the weekends. So every license I have used, and I'm still using today. And then I'm a continuing education provider, so I do give CEUs. I have been a clinical aromatherapist since 1996. I do want to throw some in there. Whether I get a chance to lecture on it or not, you're going to get a PowerPoint on it, a color PowerPoint, because you have to understand what these oils do for the skin and what they do to a person psychologically as well. They're very, very important. I've been a makeup artist since I was 15 years old. So I'm working on my 19th year as a makeup artist. I love it. It's the first thing I did. And then, of course, the whole Tino Lerma Institute of Medical Skincare is my DBA that I got probably a year or two ago. I was training before then with a different company name, so I have been teaching these type of classes for at least 10 years. All right, I have trained in Europe. I've trained under medical doctors with hydrotherapy training, with Eastern medicine training, and with spa training in both Poland and in Germany. And I have taught there as well, and I have trained everything from hot stone massage to microdermabrasion in Spanish in Mexico. And so that was fun. And then my proudest achievement was when Bonnie Day from the former American Estheticians Education Association felt that I was a legend in the making at the time. Not too young to not too old enough or old enough to be a legend, but I have been in Skinny magazine as a 5-star esthetician.